We are in Module 3 of the CHS training for Quality and Accountability focal points, looking at what you need to know on each commitment of the CHS in order to support your organization's implementation of these commitments. In this presentation, we are going to look at Commitment 3. Commitment 3 of the core humanitarian standards states that communities and people affected by crises are not negatively affected and are more prepared, resilient, and less at risk as a result of the humanitarian action. The quality criterion is that humanitarian response strengthens local capacities and avoids negative effects. Commitment 3 recognizes the need to build on local and national capacities when responding to disasters, ensuring local control over decision-making and resilience to future shocks. It also stresses the need to prevent or mitigate unintended harmful consequences, which is the principle of do no harm. There are 6 key actions for Commitment 3. Key Action 3.1 Ensure programs build on local capacities and work towards improving the resilience of communities and people affected by crises. Key Action 3.2 Use the results of any existing community hazard and risk assessments and preparedness plans to guide activities. Key Action 3.3 Enable the development of local leadership and organization in their capacity as first responders in the event of future crises, taking steps to ensure that marginalized and disadvantaged groups are appropriately represented. 3.4 Plan a transition or exit strategy in the early stages of the humanitarian program that ensures longer-term positive effects and reduces the risk of dependency. Key Action 3.5 Design and implement programs that promote early disaster recovery and benefit the local economy. 3.6 Identify and act upon potential or actual unintended negative effects in a timely and systematic manner, including in the areas of A. People safety, security, dignity and rights. B. Sexual exploitation and abuse by staff. C. Culture, gender, and social and political relationships. D. Livelihoods. E. The local economy. And F. The environment. There is also a prevention of sexual exploitation and abuse and harassment requirement to fulfill these indicators. Programs need to identify and act upon potential or actual unintended negative effects related to SEAH. Let's have a closer look at Key Action 3.6 for a moment, because it is particularly complex. Key Action 3.6 contains many different components, but the PSEAH requirement can be met through several different actions. Project assessments and context and stakeholder analyses need to include potential risks of SEAH. Organizations need to continually monitor and identify potential or actual unintended negative effects of SEAH. If negative effects related to SEAH are identified, they must be acted upon in a timely and systematic manner. For instance, by adapting the program design, by providing assistance to SEAH survivor victims, and having a clear response where a staff member is the perpetrator. What type of things might your field teams be doing if they were fulfilling Commitment 3 key actions? Staff working at the project level will carry out hazard, vulnerability, capacity, and gender assessment analyses. They will monitor for negative effects. They will put in place security, contingency, risk management, and preparedness plans. They will monitor local markets, conduct local economy analyses, and carry out post-distribution monitoring. There will be country or project level exit or transition strategies in place. Do your teams conduct these processes in order to ensure that the humanitarian responses strengthen local capacities and avoid negative effects? If not, there might be examples on this slide that become part of your CHS implementation or improvement plan. There are two organizational responsibilities for Commitment 3. 3.7 Policies, strategies, and guidance are designed to a. Prevent programs having negative effects such as, for example, exploitation, abuse, or discrimination by staff against communities and people affected by crises, and b. Strengthen local capacities. There is a prevention of sexual exploitation, abuse, and harassment requirement to fulfill this indicator. The organization needs to have documented policies, strategies, and guidance in place to prevent SEAH. This can include complaint mechanisms and whistleblowing policies. Organizational Responsibility 3.8 Systems are in place to safeguard any personal information collected from communities and people affected by crises that could put them at risk. There is also a PSEAH requirement to fulfill this indicator, that there must be a system in place to safeguard personal information related to SEAH incidents that could put affected people at risk. Are these organizational responsibilities requirements covered in your organization's document, and if yes, which ones? Here are some examples of policies and guidance that meet Commitment 3 organizational responsibilities. Do no harm policy, Code of Conduct, Context Analysis Procedure and Process, Exit Strategy Guidelines, Gender, Diversity, Inclusion, Protection, and Safeguarding Policies, Complaint Mechanism, Whistleblowing Policy, Programmatic Risk Assessment Guidance, Data Collection Policy Statement, and Procedures. Does your organization have these in place? If not, there might be examples on this slide that become part of your CHS improvement plan. Policy is usually set at the highest level of an organization to set the expectation for universal compliance and standards. For example, gender, diversity, inclusion, protection, and safeguarding policies form the core of an organization's values framework. They will not change regardless of the context. Another example is that the requirement to design an exit strategy will not change by context. However, each context, project, or country strategy will have its own exit strategy. The process to analyze local context might vary based on levels of cooperation with other agencies or local government. Local data collection protection measures will vary by the type of data being collected. For example, if all information is collected manually, how that is stored will be different from organizations using tablets and apps and storing information in the cloud. Here are 3 questions that can be asked to communities when monitoring or self-assessing Commitment 3. In relation with Key Action 3.1, communities are asked if they feel the support they receive prepares them to live without this type of aid in the future. In relation with Key Action 3.3, the question is, do you feel that local service providers, that is local authorities, healthcare providers, and/or community leaders, are more capable to respond to an emergency in the future because of the assistance that has been provided? In relation with Key Action 3.6, the question is whether the support had any negative impact on the community, and communities are also asked if they feel safe when accessing aid or services. This is the end of presentation on Commitment 3 of the CHS. Communities and people affected by crises are not negatively affected and are more prepared, resilient, and less at risk as a result of the humanitarian action. Take the necessary time to reflect on this commitment and eventually move to another commitment or listen again to this presentation.